you can see here. Yeah, I think speaking here better. Yes, good day to all of you. It's wonderful to be back again, and once a year we get together. It's fantastic to see all of you with a special interest in the integration medicine. I think immunotherapy is a very important sector in cancer patients management, as well as trying to induce the complete remission, of course, trying to offer further options for more options for cancer patients, often faced with reducing in their lifespan, and also, three things that a cancer patient have is that shortening lifespan, and then secondly, shortening of their treatment options, and then the third one is the money, shortening of their financial options. So we need to find effective, safe and effective treatment options for them, and also one of the very important modality is actually through heat. Heat temperature treatment is considered natural therapy. Can you hear me? Maybe I will use. Is it better? Testing. Oh, yeah. This is much better. Yeah. So, let's begin with we'll talk about immunotherapy, and we'll talk about also inducing contributions, and also talking about heat-related induction of tumor vaccination. Let's see a case first. This is Mr. C, a 50 years old Malaysian, diagnosed with white breast carcinoma, came to us, and then already metastasized to lung, liver, and bone. This is a difficult case, and also is heavily treated. From May 17, you can see the history. The mastectomy is done, chemotherapy done, hormonal therapy done, and it failed, and it came back with more treatment and more tumor. And then in April 25th, 17th, and 24th of the April this year, 25, right? 2 cycles of eribulin as well, and she came from a family history with strong family cancer history. And then the mom also have a tumor, and then moms and daughter have this tumor and breast tumor, and also they are hepatitis B carrier. So when the patient arrived to us, we actually do a good review, subjective, objective analysis and plan. We do a very detailed checkup and also understanding about the patient. We also review the MRI data paper. There is also lesions in the brain already at that time. So this is a difficult case and also heavily treated case. So nevertheless, we take the case, and also this is comparing from the September to April. There is also widespread diseases around in the body compared before and after. This is when the patient arrived to us. And the PET scan dated on the April 15, the left lung with the nodule, and also the left lobe in the liver has metastasis, and hepatomegaly as well, and left pleural fluid. There is a pleural ascites and also ascites, pleural effusions. So this is how the patient looks on the May 5th, and then this day 1 is really sad to see this patient, and then later, 10 days later, there's a lot of improvement. What happened in 10 days is that there is a program that we have the patient go through. This is especially 20 hours of the remission hyperthermia. So this is the patient phase, very sad, suffering from a lot of heavy treatment. 14 days later, we introduce and teach the patient how to do the intensive Gerson therapy, modified Gerson therapy, including coffee enema, detox, and also liquid diet, and as well as nourishment. And this is the photo of the remission machine. Hyperthermia directly placed probe directly placed over the abdomen area for systemic effects. This is quite intensive, morning and evening double sessions, 2 to 3 hours per sessions. 14 days later, there is some smile on the face of the patient. So in cancer management, whether the cure is there or not, the hope is there, but putting back some smile back to the face of the patient is an important thing. So the treatment outline is in the 3 weeks block. We did the treatment in 3 weeks block. It's 3 weeks and 3 weeks and 3 weeks. This is the detail of the 3 weeks, including the detailed checkup, local regional hyperthermia, systemic whole body hyperthermia, subcutaneous injection of the immune stimulant, and you can see that this is there is oxidative therapy, oxygen therapy, also oxidation therapy, and IBD. You can see that this is IBD, insulin potentiation therapy with the low dose plant extract, phosphatidylcholine, Myers. This is the second week. After 2 to 3 weeks here, preparation of the patient, we send the patient also combined with a low dose radiation for 10 sessions, 2 weeks. And then you can see mistletoe Immunotherapy is a very special immune stimulant, GCMAF, thymosin alpha 1, and then this patient also specifically go through FMT, the full microbiome transfer, as well as anti-sense treatment, NK cell therapy as well here, cellular therapy. And then the cellular therapy was, I think, also started before, usually. Before or during the low dose radiation, NK cell sent for culture. Then this is the third session. Interestingly, there is a dengue fever of this patient. This patient actually suffered dengue. We love the fever, but not the dengue. But actually, the patient's immune system is sensitive and aroused enough to have a reaction. So it is we sort of welcome fever for the patient. Fever is the only way that the human body shows a response to treatment, and also the T cell, the B cell shows cross-talking and also sensitization. So these are the rest of the plant extract treatment and HAP protocol, DCA, albumin, TPN, proteins, thiamine, etc. So this is the treatment detail basically surrounds helping three things. The three directions is the human body, helping the human body to survive, and survive the body by detoxification, opening up, and then putting in good things into the body. So the out and the in, helping the human to survive. The second thing is to preserve and reserve the immunity, helping the immunity to go up rather than go down. The third one is actually to tackle with the cancer, try to kill the cancer and not the host, and not the human immunity. So that's important. So that's the three direction, and then the fivefold actually is surrounding this problem of cancer patient. Cancer patient come to us with immune system low immune system for sure, and immune system is corrupted, and then lacking of the fever. Usually cancer patient is difficult to get fever, and then the cancer cells and tumors in the body is hiding, and then there is this devastated bone marrow or the thymus after the heavy treatment. These are the 5 top problems of the cancer patient usually. So the 5-fold immunotherapy with the vaccinology in mind is that the immune stimulation, first thing is trying to immune stimulate them by selenium. KLH is actually the Immunotherapy, a very important immune stimulant. We can also give GM-CSF. One of our ways is also to reverse and revive the corrupted immunotherapy, the immune system by low-dose ICB. ICB stands for immune checkpoint inhibitor blocker, such as ipilimumab, nivolumab, pembrolizumab, bevacizumab. So then the third one, this is given 5% each item into a drip of 100 cc to 500 cc once a week. Then the patient usually develops some fever after that once a week. And then this local regional hyperthermia heat up the tumor per PET scan. On the PET scan, ultrasound, we can know the location of the tumor, heat them up by hyperthermia and also Colis vaccine injection into the tumor. One of our strategy is also intratumoral injection, and then plan the heat up. Plan the heat up by 2 to 5 times a week, every day almost if you can, and then do the fever training once a week, spontaneously systemic fever. So local regionally, we heat up the tumor twice a day and try to do it every day, Monday to Friday or Saturday, Sunday, try to do. as intensive as possible, and then we expose the patient to low dose radiation working together with the hospital, and then letting the patient to go through the low to medium dose 2 to 3 gray G1, 2 to 3 G for about 10 sessions. So plan the radiation, low dose, and then we try to give tumor specific antigen tumor vaccine as well, personalized vaccination to the patient. And this is what happened to the patient as well. And then the cellular therapy. Okay, so this is like a zoom in and then the zoom out. Okay, the zoom out is the cellular therapy, the NK cell, DC, CAR T, etc. It could be a good option as well for the patient. Yeah, so that's the case, and we should discuss why is it so hard to cure cancer. Actually, it's all in our mind. People always think that to cure cancer is hard, it's difficult. But even though the cure is not there, or you do not believe in this cure, it should not be used as an excuse for us not to excel to the next level, or to increase our knowledges, or keep on giving options for patients and seek new, available, affordable, and also safe and effective treatment for the tumor patients. Okay, so let's discuss a few features. Why is it hard to cure cancer? First of all, the cure is actually an intention. In everything, we should have an intention. The intention is to cure. Okay, the intention to cure, although there's no study, this study, that study, or difficult to get study, the whole idea is to have this intention to cure. And the intention to cure comes from God, actually. It is God's idea to heal everyone. The original design of God is with a purpose, and the healing principle is already installed in us. So the intention to heal and the intention to cure is a godly idea. And then God installed this immunology into our body with the antigen, antibody, and the memory. Immunology, in the past 3 days, the pre-conference workshop until now, every wound healed is because of the immunology. Okay, even now we can see so many wound care and all this orthopedic and all this is wonderful. We're so happy that specialists from the NSL specialists from India came here to train us on all this. Every wound healed in the body is because of the immunology installed by God in our body. Antigen, antibody with the memory. So we need to know where's the antigen and then help the body to produce the antibody. Antigen, antibody, then increase the memory by them fighting, okay, and then retain the memory. So in order to do that, there is this innate T cells and then the B cells. So the T cells from the thymus, B cells from the bone marrow, okay. So T and B is very sensitive, and then they're corrupted, I know, but then they are so sensitive to full body chemotherapy or overdose. So we need to understand how to give them correctly. So that's why the need of integration is great. Okay? And then with the immunology, then we need to really spend time on understand how the cancer comes about. And then that's why there's oncologists. But then when you zoom in too much, the oncologist is actually treatment-based, oncologist, drug-trained, and then maximum dose approach. But then, with the treatment-orientated, yes. But then after we understand the treatment, we also need to understand why the cancer is happening. Okay, the formation of tumor, and then I think immunology will surpass the understanding of cancerology and also the oncology, and as well as the virus. In many cancers, there's a lot of virus happening. After the pandemic, there is so much of side effects and also mRNA vaccination and also injury. So virology is there, and then there's this vaccinology is there also. But then, these are all the treatment options and drug-based treatment. But then at the end, the treatment, it is always interacting with the immune system. So the intention to cure is important, okay? So understanding of the immune system is important. So why is cancer difficult to heal? Also because we are in a system. The system is created with available drugs, chemical injection, multi-dose approach, and then the company, and then there's this insurance setup with the government setup as well, and then there's this schools and academy of doctors and spokesperson, KOL, and then there's this hospital center, injection center. So this is sort of like a fixed system that is actually leading a lot of massive palliations. So a lot of patients are being palliated first in order to go into immunology and also go into cellular therapy. I think we should turn it the other way around. So we try to avoid traps like this and also try to avoid extreme situations like this. For example, the patient always spend time in the home, go to hospital, and then home and hospital repeatedly. Then later they go to hospice directly. So as a patient, many patients are not happy because they only choose home or hospital and then hospice. There's no other options available. So I think that's why we get together to, I want to encourage all of you not to just stay in Malaysia, but also fly all everywhere if you can, to understand what is integrative oncology and also learn a lot of things and bring our knowledges to the next level, and to bring treatment modality and also treatment options, make it available, and then bring home with this technology and also network together and partner, and then make it available for patients to use. So those are the tracks. And then one of the reasons cancer is difficult is because there's stage 9 cancer. So a lot of people understand stage 4 cancer, right? But what is stage 4, 5, 6, 7, 8, 9? So we need to understand, first of all, there's a human with the cancer. Okay, cancer patient is a patient first, then there's a cancer. So understanding the patient is important. In stage 5, 6, 7, 8, 9, what does that mean? Many cancer patients have cancer cells trapped inside the body, and then the cancer is hiding, and then the cancer is residing, and then the cancer is actually locked and stuck inside the body. So it's trapped and it's not drained out, and not even a chance to come out, or not even a chance to be aborted out of the body. Okay, so this cancer abortion is real. We can talk about that later. The immune system is trapped, suppressed, or not unleashed. Many cancer patients with immune system suppressed and not unleashed. And then the chemo, radiation overdose, toxin trapped inside. The cancer patient is a patient with very slow metabolism and also stuck situation already. And then then we pour in further rubbish into their body, and we have to understand also whether putting in is easy, but letting them to come out is a bit hard, and also we need to plan for them. And there is also hypermetal toxicity, severe HO toxin hindrances stuck inside the body. There is a lot of blocking factors in the human host and the immune system, stopping the patient from healing. And also often, yesterday, I think 2 to 3 days, I think these few days, doctor yesterday talked about cancer patients having severe malnourishment. So many cancer patients are dying because of starvation, actually not able to eat well, maybe from so much of vomiting, nausea, and all these things. So these are the stage 9, 9 other stages, 5 other stages that is already inside the patient when they come to us. We also need to take those into account. Yeah, this is a very actual slide that changed my life, because one of the errors is that many doctors are focusing on tumor management only. We are failing to get the healing going into the human. So rather than just tumor management, we need human management. So if we just focus on tumor management, 85% palliation, and then 15% healing. So that's empirical approach. So we should be personalized and precise. And if we convert into personalized and precise approach, actually out of 85% palliation, there is this disease progress means palliation, right? There is this progress, partial response, complete response, of course. This CR is complete response, partial response. There is this stable disease and then disease progression. Actually, out of 85, maybe about 15% is real palliation. And there is this big chunk here requiring us as an attention to the patient in full details. So we cannot just spend 20 minutes and ask them to go out of the clinic. So these are the patients that we need to full-time understand their background and also collect all the clinical information and try to do a good subjective, objective, and analysis. And then we do a planning for the patients and integrate the treatment together. So what's the best solutions here is that this area of error. So we need to always discuss, do we know well about the patients? Do we know their immune system? Do we know our treatment available for them, or whatever treatment that they have failed before or successful before? And we have to fully understand cancer as well. So cancer, when we manage the cancer patient, it's not just about killing the cancer, but then at the end the cancers and the treatment kill the immune system and kill the patient. Okay, so it's very important for us to balance these 4 areas up. And then help the patient to interact with the immune system, patient to build the treatment, and react to the treatment and build the immune system and kill the cancer. Okay? It's not about killing the host and then the cancer get killed. No. So we have to really improve our knowledge and also our options. This slide talk about, we need to also then zoom in to understand the cancers. This slide talk about heterogeneity. Is very important because in every tumor, we need to have a full understanding of tumor, whether they have a solid realm or liquid realm. Okay, you can be tumor-free but not cancer-free. Because cancer is a syndrome grew minus 5 years, 10 years, 15 years, 20 years ago. If you have a 1 cm tumor now, that process of growing cancer in your body, okay, it actually minus 15 years, 10 years, 20 years ago. So that is the liquid realm. But then the solid realm is this. If you have a solid tumor, you can see. So cancer actually always have a latent phase, and then they're detected late, and then brewing silently, and it has a stealth, it's a crime that they are organizing, and then it is stealthily in your body. When you have a tumor more than 0.5 cm, then only it is detectable by ultrasound or the PET scan. And at that time, they already have their own chain supply and also neogenesis, then they can form their own vessels, and they are like an embryo, basically. You're pregnant with a tumor already. And then they have their own breeding system, syndicate, and then more than 30 types of different cells is there in a 0.5 cm tumor. And then more than 30 billion types of cells, different 30 types of cells, and more than 30 billion cells in the tumor mass. And then bad cells, maybe about 10%, 5%. So just now I think Dr. Pomare talked about this as well, the tumor heterogeneity. And there is a good cells also inside there. So as if these good cells in such a close proximity to the tumor, but then they are not killing the tumor but helping the tumor. So there's this immune corruption and also immune senescence inside there. So the bad cell ransoming the good cell. So it's like a terrorist village basically whenever you see a tumor. So it's not just that easy straight call cut, if you have a 5 cm tumor, 10 cm tumor, 100% of the tumor is a bad cell. No, actually the cells, maybe about 5-10% is actually a bad cell, but then the rest of the cells are the supporting cells. So we can convert those supporting cells and help the tumor to regress. So in every tumor, 10 to 15%, 20% bad. I think personally I have this bias is that it's just 5% or 10%. Okay, and every tumor has a mortal part and immortal part, the visible and invisible part. The one that we can see on the tumor surface on the scan, or you can press on your lymph node or in the breast, is actually composed of the weaker cell and the stronger cells. Okay, these are still mortal cells, they can die. You can use the 5-fold theory and also deal with the solid tumor. But what is very dangerous and recurring is actually the liquid realm. The liquid realm is actually the cancer stem cell, which is 3 types. There are 3 types of cancer stem cell we're talking about. There is this cancer cell inside the tumor, okay, cancer stem cell inside the tumor, and there's this circulating tumor cells, and there is the third one is called the circulating embryonic cancer stem cell. That is the great grandfather kind of thing. No? So there's deeply hidden tumor cells inside every visible tumor. And then solid tumor wise, we can actually try to learn how to convert a solitary tumor into a vaccine, and the art is that how you can identify the antigen and also try to extract them and also process them. While the tumor is growing on a human body, you can actually manipulate those tumors and convert every tumor from the enemy becoming a friend. That you can actually retrain, ransom the tumor and hold the tumor and inject something to irritate them. Okay, heat them up. Okay, give them some low dose radiation. Okay, let them leak out, and then make it into a training camp so that your immune system is able to see. Now, basically, is to convert the tumor and make it visible, make it hot, make it exciting, make it obvious rather than hiding, make it obvious rather than occult. Okay, teach them how not to hide, but actually revert them. Sort of like a socks, your stocking, right? If you can revert them, turn over your socks, you are able to see the internal pattern of the socks kind of thing. Tumor is always like a onion, multiple layers, and in every layer there is this tumor-specific antigen, and you can actually expose them layer to layer, layer by layer. Okay, so take your time to actually regress the tumor rather than rushing through it. And it's very important. And also the tumor is like a terrorist village. Okay, it's also like a baby. Okay, once you have a tumor formed in your body, it actually behaves like an embryo. Like a mother and a pregnancy. So it has a lot of embryonic features. That's why it has this obligated glycolysis that you can actually break and reverse them. Okay, so this is the diagram talking about how a local tumor can have a EMT, epidermal, mesenchymal transitions, and then they detach away, and then they circulate, and then they go to another place. From the mesenchyma going into epithelial transition, MET, from the EMT, and then the MET. So this is the EMT and MET. So that's why it's called metastasis. So cancer stem cell can do that because they are embryonic. Just like your nail, the nail can become embryo cells again and trying to form a breast cells or recommitted into a brain cell. For example, a brain mature cell, they try to reverse engineer themselves into embryo, and then they go into a toe and become a toe cells. So normally all the matured cells, somatic cells cannot do that. But cancer cells, yes, because cancer cells they have this embryonic nature, and that's why they call it cancer cells. So the circulating tumor cells is always with three types. So this is the cell fragment, okay, dry and dead fragment, or the circulating cells that is still dead cells, and then the live cell, and then this embryonic marker. This is the embryo, the most immature and most primitive cancer stem cell is called embryonic cancer stem cell. If you want to catch a cancer stem cell, you can catch this type of cancer stem cell, the embryonic type. In the past, more than 10 years ago, we visited this large Florina with our Indian friends, and also we visited this large RGCC lab. They are one of those IVF type of lab that is able to catch this embryonic cancer stem cell. So why do people get cancer? If you ask immunological answer, is actually the body is unable to reject the foreign body. Okay, it's a weakened immune system is corrupted, and then inability to have fever, the immune sensitivity gets destroyed, and then the cancer is hiding, and then 10 to 20% of cancer cell is shielded by the 80% of B cells. So that's the problem. So we can induce the relapse-free complete remission by a few methods. So since the patient is always going through this surgical therapy, radiotherapy, chemotherapy, and repeating, and then later, then only they are given the option of immunotherapy or cellular therapy. Since we are going through this anyway, maybe we can actually reverse it, do the last first and then the first last. So how does that? Is that focus on the cellular therapy and immunotherapy? Hyperthermia can help do that, and then low dose radiation, and then work with low dose chemo or intratumoral chemo, and then maybe the surgery. Okay, 15 cm surgery is different from a 1.5 cm surgery. Maybe the 15 cm tumor can be shrunken first, later the surgery can be done. Okay, so there's a big difference between doing the surgery later when the tumor is regressed a little bit. Okay, that's also is possible. So why do we think the other way around is important? NK cell is APC, basically antigen presenting cells working with EC, macrophage, form cells, and it's very powerful to talk to B cells and T cells. So NK cell is wonderful. And then it's totally possible to revive cancers without any knife, okay? And then, for example, the lymphoma, leukemia, okay, we cannot cut them, okay? And chemical drugs, and then you can achieve complete remission is possible, okay? Not just tumor-free, but cancer-free, okay? Tumor-free and cancer-free. We need a strong immune memory to reject the cancer in the future, so that's why the crosstalk must be protected. And then cancer rejection immunity is there. So we want to know how to blacklist the cancer, help the patient's immune system to see the antigen and then preserve the immunity. And then try to induce a whole body tumor abortion, that is very important. So it is possible to have complete remission and relapse-free complete remissions, okay? Without relapse. So this is an example, Emily Whitehead. This lady is more than 15 years cancer-free right now. These are lymphoma, leukemia patients. Wonderful, This is almost dying. This is go home and die, kind of thing. 9 years old, I think this is 9 years old, and then this is 19 years old. Okay, and these patients' blood now actually already have a full immunity against CD19 and CD20. So not just lymphoma, not just leukemia, she's cured, but the scientists follow up and found out that they have natural occurring immunity in her whole life. She will not get CD19 and 20. That means cancer. That means it's like a lymphoma, leukemia also. Because she was treated for leukemia, and then the lymphoma also is prevented because of the powerful of the immunity that's long lasting. Okay. So the treatment that she went through is CAR T. Basically, take your blood, okay, and then expand it, and then grow it, and then put a CAR there, the chimeric antigen receptor, and then engineer the T cell to kill the CD19 and CD20. Okay, and then before drip back, there is this flu-cy protocol, 5 days, 3 days, flu-cy protocol, flu therapy, side therapy, and then kill off all the old corrupted immune system, and then induce the complete remission this way. Okay, so NK cell is wonderful also. You can actually do the blood collection. So not necessarily we must do a CAR T and all these things, but then there's this NK cell, whatever, same thing. Take the blood collection, isolate them, and then activate them, quality check, and then deploy back to the patients autologously, or also from siblings, it's okay. I think this we talked about last year with I think this is our patient a few months ago, I think, and this is the before and after. You can see this is a big problem, and then this liver so much problem, and then before and after and all this, yeah. So immunology is badly needed in cancer because God installed the immunity in human. Let's not destroy it, but find out the antigen, antibody, and create a memory. Let's try to help the patient to overcome cancer like flu. You can never get the same flu twice, okay? So we can help the patient to face the tumor actually rather than letting the cancer hide, and then we inject so much of this chemo into the body, and then rather destroying the immunity than cancer is more than killing the cancers. Okay, so the innate and adaptive immunity is to reject cancer once and for all and induce cancer abortion globally. Basically, certain portions of your body with, let's say if you have a 10 to 20 tumor, local, regionally manipulate a few tumors, and then you induce a full body response, and the full body response is able to help you to clear the rest of the tumor in your body. That is what we call the relapsing complete remission. So the grand simple goal here is actually lifelong cancer rejection immunity. We try, and whatever it takes to help the patient to develop the immunity that can reject the cancer itself and last a long life. Okay, that's important. So the goal of cancer immunotherapy is to raise up the survival rates, basically. And if you see that conventional therapy without any combination is as good as no therapy, but then if you check if the patient is still alive or not, if the patient is still alive, usually is immunotherapy. They have involved the recruitment and immune system. Those people who help the patient to survive, they have to involve the immune system, and especially the combination of immunotherapy. Combine a few more methods together is important. Okay. And why is that so? Because in immune system there is this innate T cell based cellular therapy, and then this is actually the adaptive antibody related arms. So immune system there is this our immune system is specific, and also with the memory, it is possible to blacklist anything that the immune system can see. That once you form the crosstalk, you are set for the whole life to reject this tumor, just like how you reject COVID, just like how you reject any flu. Okay, it is possible when the antigen is being made obvious and also visible. Okay, 10 minutes. So teaching the adaptive immune system to see the cancer is very important. Activate all the cells and then present the antigen, train the T cells to talk to the B cells and then kill the target and let the T and B multiply. It's very important. So I just want to recap all of you the immunity system, immunology in our body is that once the antigen is there, there's a clonal expansion, then differentiation. Then this activation phase, then to eliminate the antigen. Once the antigen is eliminated, then the cell immunity, then apoptosis. And then this B cells or T cells, the retention is always there. We want to achieve this retention of memory from the T to the B. That's very important. So you give some time, and then usually it takes about 20 weeks, 10 to 20 weeks at least. So initially, the bad guys is here, the T cell came out, and then the T cell killed the bad guy comes down. Then the T cell will just rest, and then while resting, it's also continue to talk to the B cell, and the B cell take over. So there's a T cell immediate memory, and then the B cell immediate memory. Very, very important to preserve this crosstalk arm. Okay. So cancer immunology is about turning the cold tumor into the hot tumor. The cold tumor turning to hot tumor is cancer vaccine, oncolytic viruses, T cell engager, innate immune system activator. This is very important, like GCMA, like GMCSM, all these thymosin alpha-1, immucotel, okay, artesunate, ivermectin. Myeloid cell immune modulators, so many long list of the plant extract. Basically, the whole idea is to make the tumor obvious and hot and highly visible to the immune system with high numbers of tumor antigen and the T cell intratumorally. And then this whole hot area would be dealt with the lymph node. So sometimes you don't need to worry about the lymph node whether it's swollen up or not. It's important. So one of the very important concepts is this paper talk about in situ vaccination for the treatment of cancers. Many of us we are afraid of the tumor. Don't be. Hold the tumor in your hand, inject something into the tumor, irritate the tumor, lick the tumor, okay, break the tumor, okay, local regionally, okay. Even when you do an endoscope, you see a tumor into the colon. Why can't you inject the tumor directly a little bit? Even with ozone or bicarb or even the artesunate or any vitamin C or any plant extract or even chemo, okay, or even ipilimumab, nivolumab, pembrolizumab, you can. intratumoral injection. This is a wonderful paper. You want to take a photo, you can check this, how to induce tumor vaccination in situ. That means while the tumor is growing into in the human body, don't cut it out. Process the tumor while it is alive in the tumor. While the tumor is alive in the patient. So this is what we call the in situ tumor vaccination program. Multiple methods to do that. So the purpose of doing that is to induce abscopal effect. Abscopal effect is actually if you have 10 to 20 tumors, you just need to do a few, shrink them in size, and then improve your immunity. And then the immunity will recruit the lymph node and fight them, and then induce a whole country blacklisting thing. So the global whole body, full body immune system, T cell, B cell come and reject the rest of the distant metastasis. This is what we call it, abscopal effect. Very common and not rare, okay, because we can do local regional manipulation of tumor to elicit full immune responses. Okay, this is a true phenomenon, okay, immunological phenomenon. Okay, so tumor regression, there are two methods. One is that you just kill the tumor, whatever things you want to do, throw in the bomb and everything, force the tumor to die off. Okay, the other way is that you induce an immunological reaction that the tumor regression immunologically is being achieved by the human host and the immune system. That is what I'm talking about. So global full body tumor regression is possible by the host human immunity, not by the other or whatever dictative method that we talk about. So the FIFO principle is very important. FIFO principle is actually widely used. For example, in radiation, maybe the doctor later will talk about the radiation. So if you have a tumor, you want to cut it or you want to heat it. Our method is actually to inject something into the tumor first and then heat it up and then low dose radiate it. So when you do a local regional manipulation, you can do a low to medium dose will increase the PAMs and NAMs. The pathogenic associated molecular pattern, DAMP is actually damage associated molecular pattern. These are the cancer stem cell die or cancer cell die. They release the antigen and then the antigen and then recruit the rest of the immunity. When a cancer cell die is what we call the ICD. The immunogenic cell death induction is very important. The way the cancer cell die is very important. Not the TCD, tolerogenic cell death. We want the ICD, the immunogenic cell death. So the art is actually the immunogenic cell death, and then you will actually mount a systemic anti-tumor attack for the rest of the distant. This way, it is healing faster and also long-lasting. Spontaneous remission, you can search online. Okay, it's very common. Okay, now it's not common, of course, but previously it's very, very common, and we can relieve this. 62 years ago, infection cure cancer. There's one doctor called William Bradley Coley. He's the guy that discovered the Coley's toxin. Until today, also we still use this Coley's toxin for intratumoral injection. And then, as a matter of fact, I want to be network together with those Coley's practitioners around the world. If you know them, you can kindly refer them, or we can actually work together for Coley's training. Important thing is that intratumoral injection with the Coley's, and also you can do a little bit intravenous, and then you can induce a spontaneous fever in the patients as well. Okay, so this slide actually is very common. You can go online and search. Majority of the complete remission, sudden spontaneous remission is always associated with fever. So let the patient have fever, don't just kill the fever directly, okay? So lifelong rejection, cancer rejection immunity, our immune system cannot kill anything that it cannot see. Okay, the whole world know that the cancer patient have cancer, but the cancer patient white blood cell doesn't know that, oh, do I have a problem? Their white blood cell seems to be corrupted. Okay, so our immune system will kill every harm if they can see it. Okay, so we need to understand that where is the cancer and why do the cancer hide up. Okay, and then the cancer hiding, where's the exact location is important. Okay, then can we get the tumor material? The second question is that can we get the tumor material? Can we process it to be antigen? Can we inject something inside? Can we heat them up? Okay, can we do some low dose radiation or even intratumoral chemo? Try to irritate the tumor and try to induce, convert the tumor as an enemy into a friend, as an education center, as a hot zone for educating, as an antigen, educating the immune system that's already stimulated, preserved and reserved and conserved. Okay. Now the third is try to induce the stranger signal inside the tumor. So actually, the stranger signal is already inside the tumor and the human host. The human host sense that there is some strange thing happening in the human body. But the cancer patient failed to have a danger signal, means or the T cell and B cell is hesitating and not trying to kill the tumor correctly. So we can inject local irritant, induce the ICD, not the TCD, but put the hot tags into the tumor. So this William Bradley Coley, very famous. You can go online and search CRI. Okay, for those of you who have a special interest in integrative oncology, you will have to, because just now Paul Murray was talking. None of us is exempted. All of us will have cancers. So William Bradley Coley and granddaughter is Helen Coley, not okay. And they form CRI, okay, the CRI Cancer Research Institute, and then they talk about immunotherapy. They are the pioneer and also very big organization, talking about integrative oncology. COVID vaccine, any users here, any one of you, we can actually, if the tumor fails to respond, you can resensitize the tumor by COVID vaccination a little bit, and then you do manipulations with. So this is the conclusion of the immunotherapy. Means release of cancer cell. Try to locate the cancer cell. Okay, induce in ICD, and then leak the antigen out. Let the antigen go to the lymph node. Don't chop the lymph node away first. Okay. Let the lymph node react with the antigen, and then let the lymph node multiply and duplicate the rest of the systemic immunity, and allow the newly formed immunity to re-enter to new tumor. That's why we need to hit a few tumor, heat up, or intratumoral injection or radiation. Later, 2 to 3 weeks later, plan another local radiation to the other side of the tumor site so that you can break it, and then also allow the new immune system to get rid of the rest of the tumor. Because most of the tumor, they are fortresses. They are with placenta. Okay, that's why the abortion tablet works. Okay, you can inject also try to basically you try to think how we can do a complete abortion of the tumor in a human person. That is an important line of thought. Okay, the cold tumor is not responsive to tumor blockages and PD-1, PD-L1, but if you heat them up, they are resensitized with the CT1, PD-1, PD-L1, CTLA4, the ipilimumab, nivolumab, pembrolizumab, bevacizumab. They will be resensitized again with the heat. So heat can inhibit the cancer from repairing and then increase the heat shock protein. Heat directly to the tumor can activate the lymphocyte and also NK cell. Heat will promote reperfusion. Heat will promote the blood flow to the tumor and clear the tumor. Heat will cause cancer cell death, immunogenic cell death. Heat, most importantly, will not damage our own cell, but actually stimulate T cell and B cell. Heat and hyperthermia will impair the repairability of cancers. So basically, heat will stop the cancer from repairing themselves, and it will help the human host to repair themselves and revive human host immunity. Okay. So hyperthermia, there's a whole body and local regional technique. Okay. So the local regional technique is this resistive type. There's also always a capacitative type. I used to treat after this 13.56 in Germany. No time. So this is the Celsius 42, and then this endomatic, and the uratum. Okay, these are the capacitative type. So and then I have a chance to go to Korea multiple years, and then we researching and also using this resistive type with a special frequency. It is a 0.46, and this frequency kill viruses. So I was deeply drawn to this because post-pandemically, I was trying to use this machine for COVID-19 vaccination related also viruses disruption. So it was a very good seroconversion for viruses. So Hep B, Hep C, HIV, all kinds of viruses can use resistive type. Okay, and then after 12 sessions, there is a proven NK cell from 4.5 to 2000 activity. So this is exciting. And heat is natural therapy. Okay. Local regional means you heat up the tumor and convert the tumor into a hotspot. Systemic, whole body hyperthermia. We are talking about the really hot hyperthermia, not the sauna type. Okay, it's totally not sauna. This is a systemic type. The Hector machine will actually boil and heat up the body for 45 minutes, and then the blood becomes hot, and then the blood will then go and treat the tumor. Okay, so this is a Hector. This is actually one of our technique also. And then radiation. Okay, doctors, I think we talk about radiation, right? The radiation actually, those would really do the 5R, repairing the immunity of the tumor, redistribute all the immune cells back into the tumor, reoxygenate the tumor, and then repopulate the tumor cells with many good immune cells, and then reposition the tumor to become radiosensitive. So this is the fractionation and also radiobiological benefit of the low dose radiation. And then the radiation is very powerful because tumor is always acidic, tumor is always lack of oxygen, tumor is always cold, and then tumor is always with immune tolerance and corruption. So to reverse that, actually just heat them up, okay? And with low dose radiation is powerful. So 5 steps is that where's the cancer, okay? Make the occult become obvious, okay? Stimulate the host. Okay, let them fight and give them a fever, and then let the crosstalk begin, and then retain the memory. Okay, conclusion, we need to conserve, preserve immune system. Okay, use anti-corruption whenever possible. Give them the thermogenic, okay, pyrogenic, thermogenic, colis, full body range, fever range, whole body hyperthermia, the Hector, the remission. Low dose radiotherapy, please work with the hospital. Together, give them biologics, okay, personalized vaccine, review the bone marrow, replenish the NK cell, why not? Okay, don't forget to manage the host, okay. This is by Dr. Tony Jimenez, the 7 ways, detoxification, big time, restore the microbiome, the FMT, full spectrum nutrition, all those tablet, oral, IV. Oxygenation is the oxygen and also hydrogen, immunomodulation, non-toxic cancer therapy, spiritual, emotional healing, very important. Okay, all the cancer cells are sensitive to vitamin C, artesunate, B17, BCA, B15, hydroselenium, Ibuprofen, curcumin, and just now EGCG, right? We learned EGCG, curcumin, yeah. Fever induction, hyperthermia, yeah. So hit the iron until it's hot, okay? Let's be the God's workmanship. So we are created by God, and then to do good work. So I think the good work is already prepared in advance for us to do, so we can walk in it. Yes, cancer we are done, and then we are very happy that in the past few years we are able to escalate our level and then to go around the world to understand how heat can be combined. And then we are associated with this International Viral Research Alliance, researching how to use frequency and also heat to disrupt all the viruses yet to be released in the world. Yes, you heard me right, and the virus is planned and also intentionally released. So healing is an art, okay? Healing is an art, it is an immunological phenomenon. So I think that's it. Yeah. Okay. Yeah. Let's keep in touch. This is.
More than this Father Gary President to give him a total notification. And normally everyone will get for those of you who bought my book, Dr. Kelly's Hyperthermia and all that is so inside the book, yeah? The information. So today is very exciting for me because almost everybody here I know them. Okay? So the next speaker, let me introduce Dr. Sudha Somappa, and she is going to talk about types of radiation therapy